more of the business side of healthcare. There are a ton of careers that are still in healthcare, but they have nothing to do with patient care. We're going to go through some of those today. Before we start, how many of you guys know what healthcare business is? Can you give me a job that falls under healthcare business? Do you think? Yeah.
A pharmaceutical rep.
Pharmaceutical rep, perfect. Just so you guys know, this is going to be very interactive today. You're going to be talking a lot. Any other ideas? All right.
What about when you go to the doctor? Who's the first person you talk to?
Receptionist, business. How do the hospitals get paid? Insurance. Okay. All right. You guys are going to learn quite a bit then. Maybe you won't learn a lot, but you'll have an idea of what healthcare business is. Okay. Healthcare is just like any other business. There is usually an organization, services are rendered, and goods are traded. You have somebody coming in, they're receiving your services, and they're leaving. They're coming in, they're receiving your goods, your knowledge, your expertise, and they're leaving. That's kind of the general idea of the business. Everybody's happy, everything's good. Most often when people think of healthcare, you think of doctors, nurses, patient care, people getting sick, they get better. But really functions as a huge organization. Okay, so healthcare business might be an option if you don't want to work with patients or you kind of don't know what you want to do. Maybe you've tried nursing and you didn't like it, or you've tried, another healthcare profession and you just realized after you were in it, just not sure that I want to do this. That's okay. It's always okay if you're unsure. But the healthcare business side of it is a great option. We do have, in the healthcare business arena in general, we do have a lot of medical professionals that come back as like a second career, or, they went to nursing school, or I even have a couple like pharmacists, things like that, who have decided, you know what, I'm on my feet all the time, I'm getting older, I really can't be on my feet, I don't want to work 12-hour, 24-hour shifts anymore, what else can I do? And then they switch on over to the business side of things. So even if it's not an option for you now, think about it for the future. If you like the science, you like math, but maybe you also like some of the businessy type concentrations, education, computers, management, law, those are all big components of healthcare business. It's really flexible. I don't know about you guys, but I'm the type of person, I get very bored very easily. I learn something, I do it for a while, and then it's like, okay, well, I've done that, great, let's move on. So the healthcare business is a really good option if you're one of those kind of people, because you can do a lot of different things. You're not going to be in one job forever. There's a lot of movement around, which is always nice. And if you have good time management skills, you usually make a good healthcare business professional. There is a lot of different types of positions within healthcare business. So each organization or each hospital typically has a finance department or an accounting department. They have a marketing department, a human resources department, a strategic planning department. So if you're the type of person who likes to think futuristically, you want to know, okay, here's where I am today. Where am I going to be in 5 years? Where am I going to be in 10 years? And where am I going to be in 20 years? If you're the type of person that really likes to do that, and you like to futuristically think and set goals, strategic planning might be a great option. Production or operations, more on the patient side of things, but it's the business. So typically a patient comes into your office, they sit in the waiting room 15 minutes, then they go back to the room, they might sit there another 15 minutes and wait for the nurse or the doctor to come in and see them. Then the nurse comes in, then she goes and gets the doctor, and you wait another 15 minutes. Then the doctor comes and sees you. You have to wait for the nurse to come back to let you go. You maybe wait another 5-10 minutes. It can be a very lengthy process depending. So on the operations and the production side of things, you would be responsible to making sure that everything flowed well, was the most efficient. You'd probably work on reducing some of those times. Have you guys ever sat in the doctor's office and sat there and thought that maybe they forgot you? No, I have. Other things, IT, if you like computers, information technology, databases, everything in the healthcare system is becoming computerized. Everything used to be done, paper charts, paper records, there was paper everywhere. Now, you don't see somebody walking down the hall that isn't carrying a device of some sort, whether it's a laptop, iPad, their phone. How many of you guys have been to the doctor where you've had to sign or you've seen people using a device? A few of you? Okay. All right. That is the wave of the future. Nobody will be using paper anymore. Healthcare is the largest growing industry around. There's 26% growth, I think, within the next 5 to 10 years. I'm going to talk a little bit about the different options, different jobs that are in healthcare business. We kind of talked a little bit about, we talked about insurance, we talked about pharmaceutical sales a little bit, we talked about medical receptionists, but there's also medical coding is a really, really big, hot job right now. We're going to talk a little bit more about that in a while. Insurance claims, there's usually somebody who's doing insurance verification or claim management within the hospital. Then there's also those same professionals on the insurance side. So there's a lot of jobs within the insurance umbrella. Health information technologists, those are usually the people who are maintaining the medical records, whether it's in paper form or in electronic form. They're making sure that everything's complete, that it's meeting the accreditation standards. They're helping usually the physicians with their documentation issues. Management, business, financial, kind of talked a little bit about those. Project management is another big area. Quality management is another area. Right now there's a big legislative push for reimbursement for value, which basically means if you don't meet a certain number of quality indicators, no readmissions within 30 days, or no post-operative infections. There are 4 quality indicators. Somebody's going in and managing all of those indicators, and your reimbursement, you get more reimbursement. If you do not if you meet all the quality standards, you get less reimbursement if you don't. So it's all kind of tied to money, but that's a really popular job. And then office and administrative support. Employment settings, anywhere you can think of that is healthcare related. Pharmaceuticals companies, research companies, hospitals, ambulatory centers, physicians' offices, long-term care, home health, insurance, medical equipment sales. There are vendors, EHR vendors, vendors that sell like the MRI equipment, insurance companies. There are even some placement companies, like Aureus is a big one here in Omaha, or CNA Industries. If you drive down Dodge, there's a big CNA building. They employ mostly business professionals to set up contracts for their travel nurses or travel PTs. So if you want to go and live in New Orleans